Welcome to the University of Virginia Palliative Medicine Fellowship. We're very excited about your interest and are looking forward to your virtual visit with us. To give you a better sense of the University of Virginia, the medical campus, and our program, we've developed a virtual tour of the main clinical areas of our fellowship. We'll start with the West Complex, which opened in 1941, and it now houses the administrative and clinical space for multiple departments. Our division, the Division of General Internal Medicine, Geriatrics, Palliative Medicine, and Hospital Medicine, is housed on the 6th floor, and we overlook Hospital Drive and the undergraduate campus. Our faculty and fellows have office space in the West Complex, and our fellows have typically used this space during research and administrative time. In non-COVID times behind the West Complex on Hospital Drive, UVA has had a farmer's market, which has local crafts, food vendors, and produce. We'll now head over to our main outpatient clinical area in the Emily Curritt Clinical Cancer Center. It is a short walk from the West Complex, either through a series of interior walkways, or you can also walk outside. Our clinical space is currently on the ground floor, but we will be moving upstairs soon to a new location. Our clinic is staffed with 3 full-time outpatient physicians during the week and has a full array of services including social work, dietitians, chaplaincy, pharmacy, and nursing. Our fellows spend 1 day per week longitudinally here. We see patients with cancer and non-cancer diagnoses, and our busy clinic is recognized as part of our Palliative Care Leadership Center. Our fellows also rotate through radiation oncology, which is also housed in the Emily Curritt Clinical Cancer Center. We'll move to the inpatient side at UVA's main hospital, which is located across the street from the cancer center. Our team operates a busy inpatient consult service, which sees adult patients on all services in the hospital. We see patients across the clinical spectrum of care, from those with new diagnoses to those enrolled in hospice. Pediatric patients are seen by a dedicated pediatric palliative care team, and our fellows rotate with this dedicated team. This is one of the patient rooms on the north side of the hospital. Through the window, you can see the Emily Curritt Cancer Center across the street, and off to the left, you can see the West Complex. UVA has recently opened a new bed expansion tower, which is the South Tower, and we've increased our hospice and palliative care services within this space. We have an additional new team room here as well. Additionally, our 3 South unit is the new home to our inpatient hospice unit, which features beautiful patient rooms with ample space for family members, a rooftop garden, and views of the Blue Ridge Mountains. It additionally has space for families and family meetings, as well as additional clinical consultation rooms. To conclude the tour, we want to mention our community partners. In addition to home visits, our fellows see hospice patients at the Center for Acute Hospice Care, which is the inpatient hospice unit run by the Hospice of the Piedmont. It is housed on the 3rd floor of the UVA Transitional Care Hospital and is a 10-bed unit providing hospice care for patients with advanced symptom management needs. We hope that you've enjoyed this virtual tour of the UVA Palliative Care Program. We look forward to talking with you further and discussing all that our fellowship program has to offer.